Data-driven geospatial analytics for COVID-19 risk and vulnerability for the United States. And the presenters are Fahad Rabbani and Samain Sabrin.
Good morning, everyone. Myself Fahad, and with me I have Sama and Sabrin from Team 8. And today we are presenting our results from the hackathon. And the title of presentation is Predicting the Fatalities and the Spatial Vulnerabilities due to COVID-19 in the United States. So we are actually working on three main objectives as a starter. So first, we wanted to apply some machine learning algorithm to determine if we could predict the COVID-19 related deaths or fatalities in the United States. And second, we wanted to apply fuzzy logic to determine a vulnerability index for United States. And third, so both of us has a pretty good experience with GIS and web-based platform. So we wanted to apply same kind of knowledge with our results from this hackathon. So those are the main objectives we're working for this during this time. So the main motivation behind the machine learning was, as you know, this pandemic is really quite a new scenario. Sometimes the relationship between several factors are not quite well known. So we decided to let the data speak for itself. And and also it's a data related mission hackathon. So we thought like it's a pretty good idea to apply some machine learning and to get our objectives, to get to our objectives. And second, some of you already know that CDC has a vulnerability index called SOVI, but it's more oriented towards social vulnerability. There is nothing related to infectious disease or health related issues. So, and also the vulnerability was developed based on the ranking algorithm that doesn't include or emphasize on the relative weights between several factors. So we collected, so from the literature review we did, we find out that these are the factors that could be relevant and easy to get within our time frame. I think so many of you already know about all these factors, but some of the factors we decided to include for COVID-19 specifically was the social distancing. It was released from a company called Unicast, and also to identify the economic impact from the COVID-19, we decided to include the CBI index as highlighted here with the green color. So most of the data are from US Census or the CDC, and also the data were geospatially coded from Esri. So we decided to work on those data at a county level. So this is the data I think everyone so in the picture, you see the grades from the Unicast. You can see most of the counties are actually in pretty bad shapes. Very few counties have really high good grades for social distancing. So just wanted to show the data here. So let's talk about how we can apply some machine learning to predict the COVID-19 related deaths in United States. Overall, we had more than 3,000 counties, and we decided to divide our 50 data between 50% training and the testing data. The normalization was min-max. Some of the other properties was we tried with different hidden layers based on the computation time and our computational capacity. We found that with 15 hidden layers, we could achieve the highest accuracy we could get. Some of the other criteria was the convergence criteria and the activation functions, and the error functions are also given here. And at the end, you see the formula used to predict the deaths given the other factors. So I think everyone wants to see a picture like this when someone runs a neural networking. So at the left, you could see the factors, and at the right, the outcome is a death count. And in the middle, you have the hidden layers, and B1, B2 represents the constant weights applied to each of the hidden layers. So now I want to talk about the model performance. So the first figure in the left shows a scatter plot between the prediction and the actual death. We see that at higher deaths, the model was able to predict the deaths more accurately, and the QQ plot shows the linear relationship between the prediction and the actual observed death. Some other statistics, such as the correlation we found between the prediction and the actual deaths, was 0.95. The percent bias was 13. And in a perfect world, the ratio of standard deviation should be 1, but for our case, it was 0.9. The Nash efficiency was also 0.9. So that's kind of a general idea about the comparison between two data sets. We also did some analysis to find out which factor has more weights for the predictions. Apart from the population density, we found that overall in the United States, as a global statistics, the number of beds, hospital beds, the ICU beds, and the number of cases count, of course, has a really high impact behind the prediction of the death. Also, we show the confusion matrix, and so this is the first time actually I have applied some kind of machine learning in R. The accuracy I got, the highest accuracy I was able to get was 0.58. Not that good enough maybe for the prediction of something important such as death, but there is still room for further improvement. So now my teammate Samuel will talk about the vulnerability index using fuzzy analytical hierarchy approach.
So hello everyone, good morning. So as our second goal was to identify counties much vulnerable to COVID-19. So we used integrated fuzzy logic with analytical hierarchy process. Next. So probably most data scientists and statisticians know what is analytical hierarchy process. So HP was developed by Thomas L. Satie, and it is a pairwise comparison method that is used to rank several criteria used in a project. So, and the significance of each factors is ranked using AHP method. So if you ever wonder that why there are 9 questions in a survey question, that might answer the question. That might answer your question. That because mm, according to the scientist, he told us that human mind cannot read more than 9 options. So whenever we tried to rank a pair of factors, we used 9 choices. So for example, if we rank a pair 1, that means both factors are contributing equally. And if it's ranked with 9, that means the first factor is contributing, first factor is more prevalence of the second one. Next. So given that the number of factors we considered, we came up with this confusion matrix after ranking all the parameters, and we calculated consistency ratio of 0.044, which was less than random index of 1.59 given the number of factors we had. This is actually pretty good because our consistency ratio was less than random index. Next. Next slide. So this is the final rank. We came up after the confusion matrix. Social distancing was ranked highest. That was followed by elderly population, stroke, hypertension, diabetes, heart disease, and next we'll show the final output. So this is so actually after we got our ranks, we combined them with all the normalized factors, and the map is showing vulnerability in a scale of 0 to 1. So keep in mind, this doesn't show the number of cases, rather it represents a vulnerability in terms of vulnerability towards COVID-19. So, and one more thing I want to show, I want to mention that social distancing, which was the most important factors in our case, was the data was collected around 26th May. So at that time, probably the red regions were not doing very good. So the map is representing results around that time period. But if we can revisit the rank systems in our AHP process, probably we can improve the output quality in future. Next.
So as I have mentioned, both of us has a expertise in a web application based on the Spatial platform. So I'm going to show you a quick demo of what we try to build within the time frame we have during the hackathon.
Unfortunately, we have to move to questions now. So
Okay.
have something that you can show a summary slide, and then we do have some questions. So I'm sorry you can't show that. Looks really, I'm sure it would look really good. What's the date range of the data for this looking
For
at?
the social distancing and the cases, it was until 26th of May from Johns Hopkins University.
And accuracy of the accuracy seems kind of low. So if you look at alternate models.
I think if we could get enough time, we could try some linear algorithm as well. For example, OLS or some spatial regression. And then we could compare with ROC curve or area under the curve to find out the best model. But within the time frame we had during the hackathon, we're only able to run only these two models.
Okay. I wasn't able to see if you included information about combinations of comorbidities, or it was mostly looking at the effect of each comorbidity.
I think overall we counted the number of deaths in a country level. That's all.